Okay, sir, we are live. So, can we start the session?
Yeah, sure.
Okay, sir. Hello and welcome to all. This is Rupsha, an assigned moderator from ClearNet. I wholeheartedly welcome all the delegates across the country. We are fortunate enough to get supported by the doctors. Thank you, all the doctors, for taking the time to join us today. I would like to take a minute to introduce our platform, ClearNet. ClearNet is one of the largest live digital CME platform in India where doctors can generate their medical content. Now, I am taking this opportunity to welcome today's Master Doctor, the eminent speaker, Dr. Neeraj Pandit, sir. Sir has done MBBS and MD. He's the professor and head department of community medicine, SBKS Medical Institute and Research Center, Vadodara. Once again, I welcome all of you at today's lecture for the topic, a new scope and opportunity of healthcare, nutraceuticals, and functional foods. Well, before starting the session, I would like to give a brief about today's topic once. Nutraceuticals are essential food constituents that offer both nutritional benefits and medicinal effects. These beneficial properties are attributed to presence of active compounds like collagen, hydrolysate, and dietary fibers. Nutraceuticals have been found to have a positive impact on cardiovascular and immune system health and prevent infection and cancer. Functional foods consist of various bioactive compounds derived from sources of plants like fruits and vegetables, marine and animal, which provide significant health benefits. So without any further delay, sir, I would like to hand over this topic to you. Kindly proceed with your talk. Over to you, sir.
Yes, Rups. Thank you. I am just sharing my presentation.
Sure, sir.
Okay, is it visible?
Yes, sir, it is perfectly sharing.
Okay. Good afternoon, everybody. So this is the actually fifth session in our series of scope and opportunity for the health sector in 5 trillion economy of Bharat series. And today we are going to talk about the nutrition and nutraceutical product scope and opportunity. This is very interesting part. This is the second last session in series. So this nutrition and nutraceutical, we will go further. The today's session's objectives are two main, and current status of nutrition nutraceutical industry in India, scope and opportunity in the 5 trillion economy for nutrition nutraceutical industry business, new idea for the young minds. We all know Annam Brahmam. We all do the prayer while taking the food. So food is basically considered as a root cause of majority of the disease. Okay. So through our food and food habit, we are introducing various diseases in our body, or we can be a healthy. So it's considered food as a best healer, or you can say food is the best doctor for you. So you are deciding your own health. So we will discuss this part today and what are the business opportunity in this nutrition, food, diet, and nutraceutical. So what is actually nutrition and nutraceutical industry status in India? What is the current status? This is very interesting. India's nutraceutical market is reputed to be a global leader at US $4 to 5 billion. It is expected to grow approximately US $18 billion by 2025. So this is very important. It's just from 4 to 5 billion to 2025, 18 billion. The dietary supplement market in India is valued US $3,924, almost 4,000 million in 2020. And report says that it will be reached by US $1 billion by 2026. It is a 22% growth rate year on year. So this is our market. See, this is very important. But see, look at the world scenario. Currently, 90% of the total global nutraceutical market is captured by US, Japan, and Europe. So 90% of the nutraceutical market is located in these three countries, US, Japan, and Europe. The global market should reach 336 billion by 2023 from US $247 billion in 2019. So by this year, it's 336 billion. But and see in our, we are going to reach just 80 billion by 2025. So this is very important. 90% is captured by these three countries. And see, this is very important. By 2030, 2023, India is also expected to hold at least 3.5% market share. So still 90%, remaining 10%, out of remaining 10%, 3.5% market share of the global market we are going to share by 2030. So it's a just peanuts. See opportunity. And this is also, next line is also very important. Currently, Indian market imports more than its export. US dollar 1.5 billion in exports and importing US dollar 2.5 billion worth of nutraceutical. We are importing more nutraceuticals than exporting. So we have a very good opportunity here is also to develop a business to export rather import. So we can generate our own nutraceutical and supply to our own countrymen. And this is a big opportunity. So this, keep in mind, this is a data number game and how we can go ahead with the sophisticated industry to the simple industry. We'll discuss further. So scope and nutritionist and dietitian. This is very important. You all know we have a nutritionist, dietitians, experts, lot of experts, currently YouTubers. You will see an open lot of YouTubers giving the guidance on the diet, what to eat, what not to eat. But we need to keep in mind these two tables. See this upper table. You must heard about the NFHS 4 and 5 data. This is a National Family Health Survey 4 and National Family Health Survey 5 data. This is blue color is a 4 and red is a 5. So see the anemia. In the survey 4, it was 58. And in 5, the recent survey, it said 67% of the Indian population, they are anemic. Almost, you can say, a 2/3 population of the country is anemic. Stunting means low height. Indians are said to be low height. See, stunting 38 to 35%. It's reduced, but still 1/3 population is stunted. Wasting, you can say a wasting is loss of weight. It's from 21 to 19%. So wasting is also a very important. And then severely wasted. It's almost, you can say, a malnourished, severely, extremely malnourished, 7%. And see overweight. Now this also increasing, 2 to 3% increased overweight. And that second graph says that the women and men, see, this is a 24% of the women, they were obese, reached to the 20, and here 22% to 18, they are the men. So both are important figures. So we have an extreme type of malnutrition, anemia, and overnutrition. We are going towards both the side. Our curve is getting flattened. So ask the question to yourself, do we eat correct? This all question for you, audience listening. Just keep in mind and ask this question yourself. Do we are on right track for food and diet? What do you prefer while selecting food for ourselves? When you are selecting food, what you are preferring for yourself? Are you trying to be fit or really fit? Ask yourself, are you fit? Do you have any skill? Considering yourself fit, or you are trying to be fit? Did you visit dietitian during your life? Till date life, I have visited during my college time. I want to increase my weight. So I visited to the dietitian and asking how to increase my weight. There are a number of people visiting dietitian to reduce the weight. So any of the scope, did you visit it? Just keep in mind yourself. I am not getting the answer, so I am just not asking your answer. Who is the taking decision for your diet? आपका diet के बारे में कौन decide करता है? Your wife, your mother, who is deciding your diet? You yourself. Need to be asked yourself. Ask this question and think. I'm just putting this question across to you because this is very important aspect. And this is a business which is going to be come up as Indian system, traditional family system is almost reducing. You can say a joint family system, grandfather, grandmother, are almost eliminating in the urban area. Nuclear families are there. So they are taking food not as per the traditional mentality. So the tradition is just losing, and influencers' life is taking care of your food also. So this is important, and how to spare yourself from this influencer and how to maintain your health in presence of such a big influencer society. So that needs to be keep in mind the role of the nutritionist and dietitian. So this is opportunity and scope for the nutrition and dietitian. Current state of the nutritionist and dietitian. How to become a nutritionist? Okay. We are saying that nowadays, any graduate, anybody, YouTuber with a very good speech and interpreting something, and they are become a YouTuber on the diet and nutritionist. Don't consider themselves. Take a expert. See, no regulatory and registration system. So we don't know how many number of the nutritionists or dietitians are available in the country. So this system is a self-made. What is currently a degree available? Many courses running like BSc, food and nutrition, dietitian, MSc dietitian, experts, diploma in nutrition, you can say a dietitian, certificate, even master courses are available, MSc and PhD. Okay, but we don't have any regulatory or registration system. So this required some, you should ask actually a person's degree. Without that, it is useless, because lot of things available online and people are reading that part, and based on that, they become a master or they become a nutritionist or dietitian. Don't consider them. So this is very important. As a supplier, service supplier also, we need to learn this part. Opportunity. Each hospital, I think you have experience now, each hospital is keeping one diet expert, or you can say a nutritionist. Why they are keeping this? Because NABH is asking. When hospital go for the NABH, requirement of qualified dietitian is one of the requirement. So now hospital is keeping. They are providing food to the patients. So each patient require different type of the food. If the kidney patient is there, their requirement are different. A liver patient is there, requirement is different. If bedridden patient is there, requirement is a different. If a patient is hypertensive, requirement is a different. If patient is diabetes, requirement is different. So this is very important. Each patient require a different type of the nutrition and diet. And according to their planning this and providing to the each and every patient. So this is a very good opportunity upcoming for the qualified nutritionist or dietitian. You need to keep in mind. So this is a status, and you can say opportunity both. Where is the scope on it opportunity? See, this is माँ के हाथ का खाना. आजकल बहुत popular है. People wants a माँ के हाथ का खाना. People are living in metro city and searching of good food, and they are always in search of the good food. See, my medical student coming in the hostel, they never like the food of the hostel, even though it's a good reason. Reason is that from all over the India, we are getting the student. Somebody coming from the Maharashtra, Kerala, Karnataka, Assam, and the food, whatever provided by this mess is almost a fixed pattern. So they feel they are almost feel it's alien like food. So maa ka khana they are always missing. They miss always their own taste. So here also some of the opportunity and scope. See, urban population across the India have become health and fitness conscious like never before. COVID again changed the life. So everybody like to be healthy and fit. And particularly in the urban area, you see the lot of people running, jogging in the morning, attending the uh, fitness club, you can say a gym. And this is providing a massive growth opportunity for the nutraceutical industry in India. Consumer taking control of own health. I am taking control of my own health. I'm conscious. I'm reading various columns. I'm reading, I'm following the people, I'm watching. There is something coming up, alternate day fasting. Then you can say a 16-hour fasting. Something is different concept coming, and people are following that, and they are sharing their own experience, and based on the sharing, people are following. But keep in mind, it is very dangerous without somebody. There are people, if you know one of the incident, I forgot the name of the YouTuber. She was since 5 years eating only, you can say a fruit and vegetable. And finally, recently I heard she died of something. I don't know, not detail I have, but some incident happened. There are a lot of followers of that particular YouTube channel. If anybody has an idea, let me know. I forget the name and I don't know it, literally. But this is very dangerous also sometimes without qualified nutritionists. See, in India, we have a NIN, National Institute of Nutrition, situated in Hyderabad. And they are doing a very good, extraordinary work. We should follow them. They have prepared a very good chart requirement of the nutrition, Indian nutrition. Recently, in 2022 or 21, they have modified their Indian recommended daily allowance chart for the sedentary, moderate, or heavy work people, male and female. They also define reference male, reference female. Please understand, please read them. It's a scientific document. And they are working very hard for this uh, community. So
Hello,
rather
sir.
following this,
Hello, sir.
hello,
Very sorry for interrupting.
yeah,
But,
yeah,
sir, can you lower down your camera a little bit because your chin area is getting out of frame?
okay, sure.
Okay, sir. Thank you, sir.
Is it
Yes, sir.
okay?
Now it is better.
Okay. So this is basically a NIN. Please follow the institute like National Institute of Nutrition, Hyderabad, and follow the documents. There are a lot of documents available completely free online, and use that document for your reference purpose. So this is a very important consumer when taking the control of own health, they need to read proper thing, not just somebody's written material or somebody's YouTubers follow. Age of personalized nutrition. See, this is very important. Everybody now, children, every mother is conscious for the child, what to give, what not to give. Adult also and geriatric also, they have their own requirement and their personalized nutritional care. Searching for the best food and nutrition. We are always searching for the best food and nutrition, which is the best for me. So this is continuous search, research-based product and search and demand. So this is very important. Now, see what is going on the nutraceutical product. I will show the startup and opportunity. It's a research-based product and people are doing a lot of work in this area. You can also participate in this area and you can join hand with the new development. Plant-based protein and others. See, protein powder, biggest business. You can see, you can visit the, you can Flipkart, Amazon, and see how much number of this protein powder they are selling. 50,000, 60,000 plus. So huge area currently in the protein powder is there. Convenience of consumption of food or diet. This is very important. My conveniency. Food is very important. Everybody is choosy for the food. So we need to keep in mind this also. Kitchenless home. Now this, see, in the urban area, metro city, Bangalore, Bombay, they don't have a kitchen. They are just keeping paying guest. So they are just pay and live in this particular area. Food is provided by the whosoever the owner is that. So completely dependent on the owner. So this new concept of coming, so they always search maa ke haath ka khana, kahan se milega. This is very important, and this new business are coming in the metro city. You know the dabba wala. Dabba wala is bringing the food from your home to your office at your time. This is very important because in Mumbai, people are leaving home early in the morning, but the food is not ready. So the dabba wala bring that food particularly from 10 a.m. from your house and reaching to you by lunchtime. So this is again dabba wala business, you know, is a very popular, and they are one of the study material for the IIM like institute also. So this is scope and opportunity. Startup. Register startup in nutraceutical and nutrition in India. So see, what are the current startup? Pilix, founded by 2019 by Rishabh Satya and the Akash Zaveri in Mumbai, nutraceutical. They based on protein, wellness product, weight loss, hair, skin nutrition, daily wellness, women's well-being, and workout supplements. This is basically they are producing the plant base. This all startup. See, second is Oziva. Mumbai headquarter Oziva offers plant-based product. Same plant-based product to become healthier. KP Mumbai-based startup, more than 40 functional food product, including herbal juice, honey, oil, plants, nutritional tea, etc. Again, the plant-based herbal juice, and that is also helpful to your. So this product base, they are preparing product and supplying to the community. Fast and up. It is a basically a flagship brand. It's headquartered in Mumbai, but originally it's actually a city working in the city like Bangalore, Hyderabad, and it's a Swiss technology. Affirmant since science aimed at promoting the active living. This is again a new type of the startup, basically a Switzerland-based company, and they are supporting for the fast and ups. So these are the different startup currently going on. They have raised the fund and very good way they are going on. So keep in mind this startup, and you can do the what startup. I'm just giving the few ideas. You can cultivate that idea. You can ask for the testing of the idea and go ahead with your own business. And this is a very good opportunity. So what are the scope and opportunity in this particular area? So learn nutrition, diet, food as a science. So this is basically I'm this session particularly those who are doing some course in nutrition, BSc, diploma, certificate, whatever. So learn nutrition, diet, food as a science, and traditional food pattern. This we need to learn our own traditional food. We lost our traditional food pattern. Like we lost care of the antenatal mother, care of the newborn because of this family size changing. Traditionally, we have a joint family, grandmother, grandfather, nana, nani, or dada, dadi always living with the children, and they help mother to how to adjust baby and mother. They also help to cook a food, what to eat, what not to eat at the time of the pregnancy, after pregnancy, immediately after pregnancy, what are the requirements. They knew many things and they transmit in the family. But we lost because of the small family size, urbanization, and we left villages and reached to the urban area. So traditional food pattern we need to learn. We are taking whatever everybody is taking, and that is a monotonous of the life. So we need to understand traditional food pattern, and this is the biggest opportunity to take and to prepare traditional food and provide them at the doorstep. Okay, you will get a lot of self-made nutritional experts on the YouTube, as I told. Others and earning like anything, scope and opportunity. If they can earn, why not expert? If you learn nutritional diet, food, why not you put your own scientific way with understanding, with proper way, traditional food, which is very good, helpful to the community. R&D new product, join hand with the good institute. Do patentize the new product. This is very important. Okay. If plant-based product, almost all four startup we have seen in the previous slide, they are working on the plant-based product. Why not you? Not only just product, but new delivery system is also very important because there are some proteins, some vitamins and minerals, they are not absorbed through the GI tract. Can we do something? See, you heard about this vitamin B12, commonest deficiency of B12, and there is required injectable, and that's very difficult. Vitamin B12 is not properly absorbed by the GI tract. So Ambition has made a sublingual. You put a below tongue and the drug absorbed through the sublingual route to the body. So you can find out the alternative routes. And this getting a very good way to introduce this product to the human body. So there are a lot of problems with the calcium, vitamin D, and there are things available. You can say a problem of the fitness, health specific disease. You identify them and provide the things. So you do the R&D and product development, patentize, and put a product in the market. Large number of the geriatric and palliative care patient. This is very important. You just go and ask the hospital. A geriatric patient required of 600 kilocalorie with the minerals and vitamin. Do we have any product? No, we don't have currently any product. Western world, they have special big product. They have a product designed with the calorie defined with required minerals and vitamins. Palliative, bedridden patient having the rice tube. In this rice tube, they have to just introduce the thing. And this is very important, very difficult. How much kilocalorie and fixed dose you have to with the minerals and vitamin. This product you can develop, you can produce, and you can supply. Big opportunity. You heard about the Hyderabad mix, very popular. For the malnutrition, Hyderabad mix was very popular. Recently, we don't know, but when I was studying, Hyderabad mix we are providing to their children. And still malnutrition, as I said, is the biggest problem. Government is trying very hard. Currently, you see anemia, government is expecting good project from the community. They are inviting the project to eliminate the anemia. Poshan Maha is going on. You can say Poshan Abhiyan is going on. They want to improve the malnutrition. Give your own idea, provide them, and best answer, government also happy. So this is few. Continue with the other idea. See, this is very important. There are three type of the nutritional problems. Malnutrition, you can say stunting, wasting, and obesity. So malnutrition is biggest problem of the nation. Government want you to be participate in this malnutrition elimination, and how best way you can participate as a business. So you can product development, supply them, and eliminate. Local level, national level, whatever level. But and you can make a chain of the food. You can make. See, here, when you are working for the malnourished children or malnourished women, your business is not going to get a good return in terms of the profit, but you will get a return minimum as a social entrepreneur. You can develop something, you can make a big team, you can try to reach a large number of the population, your turnover is high, you can able to earn. So how to do the actual entrepreneurship or social entrepreneurship, that also you can mix up the things and you can support the nation. And this is very big problem. It is not a one person. It is not just Pradhan Mantri or some one person to do the job. You need to collectively work on this part. How do you contribute this? Big idea for startup. Create a product for the local food-based solution. See, create product or local food-based solution. You collect the people, ask them to sit together and find out the best solution for their society. See, this is very important. So you can play this role. International Year of the Millet 2023, you know, the millets are very important. We almost forgot to take a millet. Now, because of this Pradhan Mantri's movement, millet 2023, we are doing lot of things, lot of recipe coming on the millet, and consumption of the millet is also increased. It is not just simple wheat and rice. Millet is also alternative for the getting the calorie with other minerals also and vitamins also. So you can prepare this area and you can develop a business in this area also. All nutrition in a capsule. Can you make? Is it possible? This is very challenging. Multivitamins are available, but their interaction is very dangerous. So they are not able to absorb. How best way you two can make a one capsule is required? Like a space person going in the space. How to manage the food and requirement. This is very important. There are a lot of research going on in this area. So can we do for something in our local people? Best way, find out and then go ahead with the business idea. Food to eliminate the malnutrition. As I said, we will discuss. Use the technology in nutrition. Can you use the best technology in the nutrition tracking? There are available that you put your daily weight, your BMI, height, your daily exercise, along with this, your food, and food with this, you can say how much calorie you are taking, how much protein you are taking, how much minerals, and how you are getting the progress. How best way to use the technology in the nutrition. So this is something about okay, early detection of the nutritional deficiency. Can you develop something on early detection of the nutritional deficiency, non-invasive, scientific, very important. We don't know about the vitamin A deficiency. The first is the night blindness. One of my teacher, Dr. Rajesh Mehta, developed a very good instrument. It's just a light source based vision. You can see it is available online and it is there. You can just put an eye on this part and you can find out night blindness. And this night blindness can prevent the many accidents for the drivers, because evening driving is very dangerous. If the night blindness is a problem and the driver is doing the driving, there are very high chances to get an accident. So night blindness prevention is also very important. We are getting the vitamin A deficiency when the Bitor's pause is coming. So we should detect early, and that is a night blindness. And that is Dr. Rajesh Mehta prepared this very good instrument. You can see online available, Dr. Rajesh Mehta and night blindness instrument. You get all detailed information. Something like innovate this. Early early detection of the nutritional deficiency and cure. Both are very important. So these are the few ideas I am giving. You can think over, you can plan something. These are my references. And if you have any query, question, you can contact me because there are a lot of ideas available and you can discuss this idea anytime. I'm open on these ideas and exercise. I think with this, I'm ending the session. I hand over to ClearNet. And this is very good opportunity ClearNet giving to me. Thank you, ClearNet. Any question, query, you can put across the group shop.
Thank you so much, sir, for your comprehensive talk. And yes, sir, we have received few questions from our participating doctors.
Yes.
Sir, with all your permission, can I put them across?
Yes.
Okay, sir. So the very first question of today's session is from Dr. Bernali Jain, ma'am. She's asking, in cases where a patient's diet may be insufficient, how do you determine whether to recommend nutraceuticals, functional foods, or traditional pharmaceutical supplements?
See, that is a very important aspect to evaluate the person. What is the requirement? Deficient in the diet, vitamin deficiency, mineral deficiency, you have to evaluate. Now, this problem, again, as I told, early detection of the diagnosis of the various deficiencies still is a problem. We are going for this uh, blood investigation, but we are not sure. See, vitamin A deficiency. The deficiency of vitamin A, if you want to see in the blood, you need to go for the serum retinol level. And serum retinol level is very costly to conduct a test. And we don't know what is the actual level of vitamin A, serum retinol level in vitamin A early deficiency, late deficiency. There are very few papers are available because of the very costly test. Similarly, it is very difficult. So that's why I'm telling you need to go for the R&D. R&D is your research and development part is very important in case of the nutrition. Currently, whatever we are doing is based on the traditional knowledge or bookish knowledge. We need to develop some new innovation, think out of and develop, find out best way to evaluate your client, how to evaluate the client. And this is going to be a big opportunity for upcoming days. So you can try to be search this particular area and we can discuss later on in this particular area. Thank you.
Thank you so much, sir, for answering. So moving on to our next question from Dr. Vivek Dash. Sir, how do nutraceuticals, the function and functional foods interact with prescription medications? Are there potential risk or interaction patients should be aware of?
Yes, definitely. This is very important. I already told the interaction, food and drug interaction. So this is very important. Whatever available through the food and you are adding, and this when to take a particular medicine, this everything you should collect knowledge and prescribe accordingly. It is just said there are many people, okay, it's better to take a after food. But if you take a calcium and something like a iron after tea, it won't be absorbed properly. Okay, so we should know about enhancer of the iron absorption or the calcium absorption. Similarly, enhancer of the vitamin absorption and mineral absorption. So we need to understand this absorption and how much absorb, particularly vegetarian diet and non-vegetarian diet. So majority of the Indian population, they are the vegetarian population. In this scenario, we have to be very clear in our mind that you should be conscious while prescribing non-vegetarian based capsule even or tablet even. So see, majority of the people now working on the plant base, even cod liver oil base, they are trying to search in the plant base. See, Patanjali has made everything plant based. So this is the way they are doing the R&D. Excellent R&D they are doing and producing the product for the community. So you need to be very cautious for the food and drug interaction. And that is very important area. Thank you.
Thank you so much, sir. So coming on to our next question from Dr. Pankaj Trivedi. He's asking, sir, from a medical standpoint, what evidence is required to support claims of health benefits attributed to nutraceutical foods?
Yes. See, this is a very controversial area because many people say nutraceutical is useless. not helpful. But see the data. In US, 90% of the market of US, see the huge, almost 300 billion market coverage. Okay, people are saying whatever, but the demand is there. Whether you prescribe or not prescribe, people is going to be on the OTC product and they are going to take the things. Okay, so now it's our responsibility to produce the evidence. Scientific evidence is the production of the scientific evidence is our responsibility as a doctor. So our client should not be misnomer. So whosoever working in the institution, they should put some hypothesis and try to see. See, it's very challenging because many ethics committee, they are not giving the permission to do the research on the nutraceutical because it's a controversial area. Okay, no problem. But whatever the people are using, you can just ask them, what are the outcome? What is the benefits they are getting out of this is you see your own friends. So you can simple do the study with your own friends and contact people who are using the nutraceutical and who are not using the nutraceutical. Based on this, you can plan the study and generate the evidence. You cannot use like a randomized control trial, but at least you can retrospective study you can do. You can do the case control study, you can see what is the outcome. You can see the cohort study planning, those who are taking, not taking over a period of the time. This is the week you can try. But it's the requirement, time, need of the hour to produce the evidence, favor or unfavor of the nutraceutical. I am not still saying I am favoring nutraceutical, but it is said that both the sides are very important. We should go as a science, we should go with the evidence. And this is our basic requirement. Thank you.
Thank you so much, sir. So moving on to our second last question from Dr. Abhishek Datta. He's asking, sir, are there any specific patient populations that could benefit the most from incorporating nutraceuticals or functional foods into their diet?
Yes. See, they basically you as a doctor, you have experience, or you can say, whenever possible, see the prescription of any doctor. You will always find some multivitamins or some vitamins. So with this assumption, it's always having something. Whenever the patient has any fever or something, they are compromised with the minerals and vitamins. So we are providing the supplements. And this supplement, majority, they are the nutraceutical product. Okay. Maybe a pure vitamins, mineral, but nowadays people are trying to see the nutraceutical based product because it's a long lasting and less harmful. So in this case, I think it's a already routine part of our prescription. As a doctor, we need to try the things, generate the evidence, and try to find out the best solution for this. Thank you.
Thank you so much, sir. So coming to the last question of today's topic from Dr. Majumdar, sir. He's asking, sir, in your experience, what criteria you advise to patient to consider when choosing nutraceuticals or functional foods to incorporate into their diet?
See, this question is as an individual. When I am taking my own health in my hand, then I have to generate my own level of knowledge. Okay, it is not just based on assumption. So it is the best. You can try to contact with the best dietitian, nutritionist, and evaluate your own health and then take the decision. It is not just what is the problem. There are many early sign symptoms of deficiency of the some minerals and vitamins. And for that, that's very important. I am telling young minds to generate the use of the AI, how to reach the best deficiency, either through the questionnaire method, or you can say a non-invasive method, like what I told Rajesh Mehta. Dr. Rajesh Mehta developed the night blindness related instrument or something other instrument, or you can say a invasive product. Based on this, your decision, but it should be decision with the your decision to take a nutraceutical or functional food with your proper knowledgeable consultant, maybe doctor, maybe dietitian, maybe nutritionist, not your own decision, just here or there reading or YouTubers advice. This is my sincere request. Try to get the best advice from your best doctor or expert. Thank you.
Thank you so much, sir, for answering all the queries of our participating doctors. And I would also like to thank all our participating doctors for their continuous participation at our platform. Once again, sir, thank you so much for sharing such valuable
Thank you.
insights with us. So, sir, with
Sure.
all your permission, I would like to sign off for today.
Yeah.
Thank you,
Thank you.
sir. Have a
Thank
nice
you
day.
all. Bye.